Welcome to the Skilled MBA Human Resource Management Case Study Series. At Skilled MBA, we spotlight groundbreaking policy initiatives that reshape societies through innovation, strategic planning, and behavior change at scale. Today's case focuses on the Swachh Bharat Mission, Clean India Mission, a landmark rural sanitation campaign that has impacted over 550 million people across India. Key strategic insights include driving behavior change management to overcome deep-rooted social norms around sanitation, leveraging multi-stakeholder collaboration, from government bodies to local communities and influencers, implementing effective monitoring, evaluation, and accountability mechanisms to track outcomes, demonstrating how strategic communication, funding models, and leadership alignment enabled systems-level transformation. This case serves as a blueprint for countries and organizations tackling complex, large-scale challenges in public health and social development. The Swachh Bharat Mission is a landmark public health initiative addressing entrenched sanitation practices through strategic management and social innovation. This presentation explores India's approach to this challenge, providing insights into policy implementation, behavior change management, and large-scale systems transformation. In 2014, India faced a severe sanitation crisis with 550 million people practicing open defecation and 67% of rural households lacking toilets. This led to increased child mortality, compromised women's safety, and economic losses of 6.4% of gross domestic product. Previous infrastructure-focused programs failed, highlighting the need for a new strategic approach. In 2014, 550 million Indians practiced open defecation, with 67% of rural households lacking toilets. This led to increased child mortality, stunting, and compromised women's safety, costing 6.4% of gross domestic product. Decades of infrastructure-focused programs failed due to low usage rates, highlighting the need for a strategic shift. Deep-rooted cultural norms linked toilets with impurity, reinforcing open defecation as a social norm. Communities often viewed it as a social activity, lacking awareness of sanitation's health and economic benefits. Government programs historically emphasized subsidies over sustainable usage, failing to address these underlying issues effectively. Strategic leadership was pivotal, requiring leaders to transcend bureaucratic silos, leveraging persuasion over directives. The core team comprised civil service veterans, private sector consultants, communication and behavioral experts, and data scientists. This diverse expertise facilitated innovative approaches to sanitation challenges, ensuring a holistic and effective strategy. Key strategic shifts focused on behavior change over infrastructure, emphasizing actual toilet usage rather than construction targets. The approach moved from subsidies to community mobilization, reducing financial incentives in favor of community-led initiatives. Accountability transitioned from process-based expenditure tracking to outcome-based verification of open defecation-free villages. The behavior change framework utilized mass media campaigns with celebrity ambassadors and viral hashtags to spread social messages. Interpersonal communication was key, with Swachhagrahis conducting door-to-door visits and community meetings. Social incentives included community certification ceremonies, district rankings, and public recognition to motivate and celebrate achievements in sanitation efforts. The Shut the Door campaign, featuring Bollywood icon Amitabh Bachchan, aimed to normalize toilet usage and dismantle sanitation taboos. It effectively reached over 500 million Indians via television, radio, and social media, leveraging mass media's power to instigate behavioral change in sanitation practices. Real-time monitoring through mobile apps tracked 600,000 villages, while 550,000 trained Swachhagrahis drove sanitation change. In just 5 years, 100 million toilets were built across rural India. A significant 35% of the budget was allocated to information, education, and communication, fostering transparency and healthy competition with public dashboards at district, state, and national levels. In Gujarat, women-led sanitation committees ensure effective community monitoring and maintenance. Maharashtra's approach involves school-based programs, empowering students as sanitation ambassadors. Tamil Nadu celebrates open defecation-free certification with cultural events, marking it as a significant village achievement. These regional adaptations highlight diverse strategies in promoting sanitation and community involvement. High-performing districts saw a 38% reduction in diarrheal diseases, boosting health outcomes. School attendance improved, especially for adolescent girls, enhancing educational opportunities. Women's safety and dignity were significantly enhanced. The World Health Organization estimated an economic return of rupees 4.3 for every rupee one invested. Over 90% of declared open defecation-free villages maintained their status 6 months post-certification. Visionary leadership combined with professional management is crucial for effective public policy implementation. Prioritizing behavior change over infrastructure addresses social norms first. Real-time data monitoring enhances transparency and competition among districts. A flexible national framework allows for regional adaptations, while multi-channel communication, including mass media and community events, ensures widespread engagement and participation. Addressing management challenges in large-scale behavior change requires adaptive strategies. Public sector leaders must balance infrastructure with social norm transformation, prioritizing cultural understanding. Effective mission-oriented teams blend diverse skills, including strategic planning and community engagement. Elements of school-based management, like data-driven accountability and localized implementation, can be adapted for global development challenges, fostering sustainable change. Thank you for exploring this public policy and systems change case study with Skilled MBA. We hope the Swachh Bharat Mission's journey offered valuable insights into scalable impact, behavior design, and sustainable development practices. For more real-world case studies on strategic policy execution, development innovation, and nation-building efforts, connect with us. Mobile +91 875 53 00795, email support@skilledmba.com, website https://skilledmba.com/